Hello everyone, welcome to your lecture on health promotion and illness prevention. This lecture will cover the key concepts from your chapter, but please go ahead and read chapter 3 from your fundamentals textbook, which will help you understand these concepts even better. So these are the learning objectives that we're going to be covering in this lecture. The concepts we'll be covering are health, wellness, and illness. So healthy people, what is healthy people, right? Healthy people sets objectives every 10 years to help the United States increase its focus on health promotion and disease prevention. It provides national objectives for promoting health and preventing disease every 10 years. After 10 years, it evaluates whether they met the objectives or not, and then it sets new objectives or continues those objectives for the next 10 years. So Healthy People 2030. Their goals are to help people attain health, thriving lives and well-being, free of preventable disease, disability, injury, and premature death, eliminate disparities to achieve health equity and attain health literacy to improve the health and well-being of all people, create environments that promote health, engage leadership in the health and well-being of all. The big question is, what is health? Health is a state of being that people define in relation to their own values, personality, and lifestyle, right? The definition of health, according to the World Health Organization, is health is a state of complete physical, mental, social well-being, not merely the absence of disease. Basically, what that means is that people who are free from disease are not necessarily healthy, right? So each person has a personal concept of health. Health is an actualization of inherent and acquired human potential through goal-directed behavior, competent self-care, and satisfying relationships with others. People adjust as needed to maintain structural integrity and harmony with their environment. So take some time. Health means very different things for different people. So reflect upon what health means for you. Now, this is Maslow's hierarchy of needs. This provides a basis for nurses to care for patients of all ages and all health settings. However, it's important to remember that when applying this model, focus your care on the patient's needs rather than strictly adhering to this hierarchy. It is unrealistic to always expect a patient's basic needs to occur in the fixed hierarchical order. It doesn't always follow that order, right? In all cases, it's important to remember that an emergent physiological need takes precedence over a higher level need, even though in other situations, a psychological or physical safety need takes priority. For example, if a patient is not breathing effectively and has low oxygen saturation, they have hypoxia, right? The need to treat oxygenation takes precedence over the need for safety and security. So if you look at the hierarchy, oxygenation is a lower need than safety and security. But when oxygenation is in trouble, that takes precedence over safety and security. So these are some different definitions of health and wellness: holistic health care, morbidity, mortality. What is wellness? Wellness is an active state of being healthy, right? Including living a lifestyle that promotes good physical, mental, and emotional health. But again, it's always important to remember that the perception of health is different for different people, based on their own values, beliefs, family, culture, community. Now let's talk about the factors that affect our health beliefs and practices, right? We have internal factors and we have external factors. Now these factors can affect us, positively or negatively, right? But they still influence our health beliefs and how we practice health. Right? We have internal factors, for example, developmental stage. The age of the person, right? A 16-year-old will have a very different perception of health compared to an older adult, right? Intellectual background, how much knowledge do you have about health? For example, think of it, how much knowledge does a doctor or a nurse have about health compared to a person who has never been to nursing school or medical school? So it's going to be very different. Perception of functioning, right? And emotional factors and spiritual factors. All of these are internal factors within us that affect our health, beliefs, how we believe about what we believe about health and how we practice health. External factors are family role and practices, psychosocial factors, and we have socioeconomic factors, our how rich we are, or how much we can afford health, or how much we can afford to be healthy. Then we have culture. Every culture is very different. Something that's perceived healthy in one culture might not be perceived as healthy in another culture. So let's talk about, this leads us right into social determinants of health. These are, the variables that affect a person's health. There are non-medical variables. So health equity. What is health equity? The attainment of highest level of health for all people. Now, the opposite of that is a health disparity, right? A particular type of health difference that is closely linked with social, economic, and/or environmental disadvantages. Basically, what that means is that a person who falls into a certain category will not receive the same health services as a person who's not in that category. And that creates a disparity. What are health disparities? What are they influenced by? They're influenced by race, ethnicity, poverty, sex assigned at birth, age, mental health, educational level, disabilities, sexual orientation, health insurance coverage, and our access to health care. So what are social determinants of health? According to the World Health Organization, social determinants of health are circumstances in which people are born, grow up, live in, work, their age, and the systems put in place to deal with illness. So these are social determinants, not medical determinants. So what are these? These are education and educational access and quality. The education you get and the quality of education that you receive. Economic stability. How much can you afford to be healthy, right? Social and community contexts. A person's relationships and interactions with families, friends, co-workers in the community, right? Impacts their health and well-being. Neighborhood and built environment. Many people live in neighborhoods with high rates of violence, unsafe air, health and safety risks. Mostly racial ethnic minorities and people with low income live in these neighborhoods, and this impacts their health and well-being. Then we have healthcare access and quality. And this is something we talked about last week when we talked about access to healthcare, right? 10% of people do not have health insurance. 33 million cannot afford healthcare services and medication. That is a huge number. So let's look at how social determinants affect people across the lifespan. And just like we said, health beliefs are different for a 16-year-old compared to an older adult, right? Same way, social determinants of health also affect people differently, right? At different levels. We have children. Their well-being depends on physical, cognitive, social, emotional foundations. They need a strong social, emotional foundation, right? And what are the risks that they have? Negative effects of health and development. So if they don't get that, then the risks that they'll have are negative effects of health and development. They're not going to develop well, right? Then you have adolescents, very sensitive to the environment around them, right? They need safe environments. So what if they don't get the safe environment? What happens? They become victims of violence, tobacco, alcohol, and other substances and risky behaviors. Adults, they need access and availability to healthy foods and access to better retail venues. For example, if in certain neighborhoods, the grocery stores do not sell healthy foods. Then you go to a different neighborhood and the grocery stores are very different in those neighborhoods, right? So that people have more access to healthier foods. So what happens when an adult cannot get these healthy foods and better retail venues, right? It causes stress, it causes injury, it causes heart disease, it causes digestive disorders. Then we have our elderly, the older adults. What do they need? They need community-based resources, social support, and transportation. A lot of them cannot drive, are unable to drive, so they depend on the community around them. So what happens when they don't receive this? They are at risk for physical disease, mental illness, and even death. So it's very important to understand, so how these social determinants of influence our patients. If you're working in peds, what do you look for? If you're working with adolescents, what do you look for? If your patient is an adult, what do you look for? And for our elderly, what are the risk factors that they're exposed to? So diversion, inclusion, and equity. DEI. Why do health disparities still exist in healthcare even after efforts to combat them are being made? Right? Why? We wonder, okay, we're living in, the United States, we should all have access to health. There should be equitable resources. But what causes these disparities to exist? We have institutional and structural racism, unconscious, implicit bias, prejudice, right? Then we have racism, the belief that different races possess distinct characteristics, abilities, or qualities, especially so as to distinguish them as inferior or superior to another, right? So what can we do as nurses? We have to become anti-racist. This is required of all nurses. Let's a little bit more about, diversity, inclusion, and equity. Diversity is about welcoming individuals of all races, religions, nationalities, cultures, ages, sexual orientations, and identities. Inclusion is about giving everyone a sense of purpose and belonging and feeling of being valued, right? Equity is not about treating everyone the same. It's about ensuring that everyone has access to the conditions they need to thrive in. So now, who are the victims of racism and structural racism, institutional racism, and even our practices of racism? Who are these victims? Who are the vulnerable population that are being influenced by these vices? What is a vulnerable population? First of all, it's a group of people who are at higher risk of poor health and health disparities or negative impacts from other factors, right? These people include racial and ethnic minorities, people living in poverty, women, children, older adults, residents of rural areas and low-income areas of cities, people with disabilities and special health care needs. These are people who face a lot more social determinants of health because they do not always have access to what they need to be healthy. What can we do as nurses, right? Our collective moral vision is for broad awareness and collaborative action in addressing social inequities and health disparities. Nurses have a responsibility, right? It is our ethical responsibility to use our voices to call for change. The Code of Ethics obligates nurses to be allies and to advocate and speak up against racism, discrimination, and injustice. We don't just go along with it. As nurses, we're there to make a change, and that is our ethical responsibility. This is a beautiful chart about how to become an anti-racist. Please read over this and reflect upon it, and as you go look at the different zones, reflect on where do you fall in there? How can you grow, right? Health promotion and illness prevention. What is this? Let's talk a little bit more about that. How do we promote health? Now that we know the vices that exist, now that we know the inequities that exist, the disparities, the social determinants, everything that causes, all the risk factors that cause a person to not be healthy, how can we promote health now? now that we have that background, let's talk about what we can do. What is health promotion? Health promotion is the behavior of a person who is motivated by a personal desire to increase well-being and health potential. What is illness prevention, which is the opposite, right? Is behavior motivated by a desire to avoid or detect disease or to maintain functioning within the constraints of an illness or disability. Health promotion is basically, staying healthy. Illness prevention is preventing health. What are the different levels of prevention? The different levels of prevention are primary, secondary, and tertiary. What is the primary level? Now we're talking about not treatment, we're talking about prevention, right? Different levels we can prevent, either illness, disease, or the worsening of disease. So primary level is to prevent or slow the onset of disease. So in this situation, the patient does not already have the disease yet, right? For example, if a patient's parents had diabetes, there's a high chance that they will get diabetes, right? But primary prevention is there to help them either prevent or slow the onset of getting that disease, right? So in this, the focus is assessing their risk factors, their health risk factors, right? So examples of primary prevention include immunizations, family planning services, providing poison control information, accident prevention education, teaching about healthy diet and regular exercise, using seat belts, using social distancing and face masks during pandemics, and safer sex practices. So these activities, this education will help a patient prevent disease or slow the onset of disease. And through these, we can assess their risk factors. Secondary prevention. Now, secondary prevention is when they have the disease. And now we're helping treat the disease, right? So for example, activities, it includes screening. And easy way to remember this is secondary starts with us, screening starts with us. Secondary screening, right? And providing education for detecting illness in the early stages. Identify an illness, reverse or reduce its severity to provide a cure. So now, for example, they have pneumonia, or they fell, or they have a wound, right? And you want to take care of that wound so that it doesn't get infected and heal it, right? Your goal is, in secondary, your goal is to return the person to maximum health as quickly as possible, right? Activities, education and activities for this include assessing children for normal growth and development, encouraging regular medical, dental, and vision exams, direct nursing care interventions to administering medications and caring for wounds. Now we get to tertiary, right? Tertiary begins after an illness is diagnosed and treated. So now, for example, that person who has a wound, their wound was treated, it's healed, and now we want to reduce disability and help them rehabilitate and help them reach a maximum level of functioning. So now we want to make sure that that wound, the disability that they got because of that wound, they get rehabilitation so they can reach maximum level of functioning, right? In activities and education include teaching a patient with diabetes how to recognize and prevent complications. So if you have a patient with diabetes, we want to teach them how to prevent complications. Using physical therapy to prevent contractures in a patient who has had a stroke or spinal cord injury. Referring a patient to a support group after removal of a breast because of cancer. So these are all tertiary activities. So now when we talk to, we're going to talk about a little bit about chronic health, but let's look at some risk factors that cause illness, especially chronic illness in people, right? We have non-modifiable ones. That's the age. The age of the person increases their susceptibility to certain illnesses and accidents. Sometimes gender affects a person's risk factors. For example, the risk of asthma is higher in males than females, right? Family history. Family history and genetics are other risk factors for some illnesses. Cancers such as breast, ovarian, and colon appear to have a genetic link, right? These patients can benefit from genetic counseling. So these are non-modifiable risks, right? I can't change my age. I can't choose to be of different, gender by birth, right? I can't choose my genetics. I mean, I came from my parents. I can't say, well, okay, I don't want to be, in this genetic line, right? Family history. Now, modifiable risk factors are smoking, drinking alcohol, unhealthy eating, obesity, physical inactivity, and not getting enough rest and sleep and having stress, right? These risk factors put people at a risk for certain chronic illnesses such as diabetes and heart disease, right? Lifestyle choices can lead to health problems that cause significant impact on our healthcare system, our economy, and our communities. Stress also threatens physical well-being and is associated with illness such as heart disease, cancer, gastrointestinal disorders. Always review life stressors as part of a patient's comprehensive risk factor analysis. Stress exists everywhere, right? It's how we manage it. Now, environment. Environment also plays a huge role in chronic illness. The physical environment in which we live in and where we work. Now, how do we identify these risk factors? Yes, everybody has risk factors, right? We all have risk factors. They're different, whether they're modifiable, non-modifiable, environmental. Now, how do we identify these, right? The first thing we do is a thorough interview with our patient to assess risk factors and a thorough assessment. Assessment is a single crucial, most important part of a nurse's role. And it's very important that we take our time with it and do it right? The use of health risk appraisal forms. So we have a lot of scales and forms that help us, measure the risk factors. For example, the Braden scale to measure the risk factor for getting a pressure injury, the Morse-Fall scale to help assess the patient's risk of falling. So these are all health risk appraisal forms. Understanding a patient's motivation and cultural preferences. Learn about their culture. Ask them, right? And see whether the patient is motivated or not to be healthy. You can't force somebody, but you can encourage them and empower them. Identify community resources. See what's available for them, especially the elderly. They're very community-based. So identify risk factors in their community. The trans-theoretical model of change, it provides stages of change in health behavior, right? How a person's health behavior can change. There are different stages. There are 5 different stages to this, and they go in a hierarchy, a specific order. But a person can also, move across these stages at different, and skip stages or return back to a stage. So basically, pre-contemplation is where a person has no intent to make changes within the next 6 months. For example, let's take an example to understand this. For example, a person who's a smoker, right? Pre-contemplation would be, okay, I don't want to quit. I have no intention of quitting. I have no motivation. All my friends smoke. I'm surrounded by people who want to smoke, and I'm just going to keep smoking, right? Then you have the contemplation, right? Considering to make a change within the next 6 months. They start to realize, maybe they saw a commercial or maybe they read something. And, maybe a friend of theirs decided to stop smoking. And so they're starting to consider a change. They're like, I need to get healthy. Within the next 6 months, I'm going to try to change. So that's contemplation. They're contemplating on it, right? Then comes preparation, right? Where they start to make changes in preparation of change within the next month. They're like, okay, I'm going to cut down on the smoking. I'm going to go from smoking 2 packs to maybe 1 pack, and then maybe to 2 cigarettes, and then eventually they'll stop. They take action. So in 6 months they stop. Now, just because they stopped doesn't mean that they can go back, right? Which is called relapsing. Right? So what they're going to do is they're in the maintenance stage now. This is sustained change over time. It begins 6 months after the action has started and continues indefinitely as long as the person decides to and stays motivated to not smoke, right? Now, remember, it's not a linear process, right? It's not most of the time it's not a linear process. People often relapse and cycle through these stages. And when relapse occurs, for example, if the person decides to start smoking again, then they return to the pre-contemplation or contemplation stage. And then they start all over again. These are the different health promotion important topics for health promotion across the lifespan, right? And we're going to focus on the older adult, but please read over the child, adolescent, and adult. So what are some of the topics of health promotion for older adults? We have physical activity, encourage them to move, right? Nutrition. We have safety, obesity, sexuality, lifestyle update of, lifestyle changes, for example. Then we have updated immunizations and oral health. These are some major topics for the elderly. Now, health promotion in the older adult. What is that? Assess for health promotion for older adults consists of assessing for common risk factors like chronic health condition, health promotion needs, including heart disease, cancer, chronic bronchitis, stroke, diabetes, dementia, caregiver issues, injury prevention. Consider an older adult's social environment and strengthen social support to promote health and provide access. They're very community-based, so, consider their social environment, what, access they have, right? Injury prevention is a key strategy to promote and improve an elderly because falls are a major cause of serious risk and injury and even death in older adults. Another thing we need to assess for is polypharmacy. Polypharmacy is when a patient is on multiple medications, right? And which is very common in older adults. So polypharmacy is associated with falls, confusion, adverse outcomes, increased length of hospital stays. It's important for us to, assess what medications they're on, do a medication reconciliation, try to understand what's causing them to maybe fall. Maybe they're taking a medication that causes them to fall, get dizzy and fall all the time, right? So, and we need to always provide our elderly with individualized assessments and care. Not everybody is the same. Every human being is very unique, and we have to treat every single person individually. Disease. What is disease? It's a pathological change in the structure or function of the body or the mind, right? Risk factors. Risk factors are something that increase a person's chances for illness or injury. So anything that puts them at risk for becoming ill is a risk factor. In your textbook in chapter 3, box 3.1, it lists some common causes for diseases. Please read over that. Now, talking about illness, it's the response of a person to a disease. So remember, disease was a pathological change. Illness is their response to that disease. For example, a person could have a disease such as diabetes, type 2 diabetes, right? Illness is their response to it. For example, if they don't control their blood sugars, they'll be ill. And so that's that's their response to that disease, right? So a person's level of functioning is changed when compared with the previous level. So when their blood sugars were controlled, they weren't ill. And now, for example, their blood sugars are uncontrolled and they're very high. And so now they're ill, right? Now, illness is classified as acute and chronic. And it's very important for you to understand the differences between the two. In your guided notes, please go ahead and take notes as, throughout this lecture so you can, note the important points of both between acute and chronic. We have rapid onset of symptoms. In acute, it's rapid. Symptoms are rapid. It's a rapid onset, and it only lasts a short, period of time. Some can be life-threatening. Simple acute illnesses do not usually require medical treatment. For example, a common cold, right? You might just need an over-the-counter medication, but it's still acute. It just had a sudden onset, and now you're sick, you're ill. If medical care is required, specific treatment, medications, surgical procedures, or another medical treatment usually help the person return to normal functioning. They take the medication, they get better. They're back to their normal functioning. What is chronic? Chronic is something that stays with you. It's a permanent change. It causes or is caused by irreversible alterations in normal anatomy and physiology. It requires special patient education for rehabilitation. It requires a long period of care support. The onset is slow, and many have periods of remission where the disease is there but the person doesn't experience symptoms, or they can have an exacerbation. For example, the symptoms of the disease reappear. For example, a person with chronic obstructive pulmonary disease, COPD, they have the disease, and if they maintain it, they keep it under control. But all of a sudden, it gets exacerbated by maybe something they got exposed to, or they got a cold, and it gets exacerbated, and then they go to the hospital. At that point, it becomes acute, because now they need some treatment, specific treatment, to make them feel better and go back to their highest maximum functioning. Factors that affect illness behaviors, right, are what? We talked about factors that affect health beliefs. Now, these are factors that affect our illness behaviors. You have internal factors, patients' perceptions of the symptoms and the nature of a disease, a patient's coping skills and focus and control over their illness. If a patient believes that the symptoms of their disease disrupt their normal routine, they're more likely to seek healthcare assistance. And if they do not perceive the symptoms to be disruptive, then they may not. Right? Patients are also more likely to seek assistance if they believe the symptoms are serious or life-threatening. Right? A patient who has high blood sugars, they might be, okay, you know what, I'm not feeling too sick, I'm okay. But then all of a sudden they start feeling very sick, they feel like serious, then they might go and seek help. So these are internal factors. What are external factors? Visibilities of symptoms, right? Social group, cultural background, economic variables, accessibility of the healthcare system and social support. Maybe they don't have access to the hospital. They live in a rural area, right? Or they don't have health insurance and they can't get help. These are external factors. Also fall within the social determinants of health. Right? A patient with a visible symptom, example, high fever, is often more likely, though, to seek assistance than a patient with no visible symptoms. So this visibility of symptoms is an important component of external factors, right? For example, a patient who's just does not have visible symptoms, for example, symptoms associated with ovarian cancer, such as fatigue and bloating. Say you're tired and you're bloated, you're not going to think, oh, I have ovarian cancer. Right? You're going to think, well, maybe nurses do tend to self-diagnose themselves all the time, right? Because we see the worst possible case scenarios, so we can't help it. But, normally a normal average person is not going to think the fatigue is related to ovarian cancer or bloating is related to ovarian cancer. They're going to think that's related to maybe I'm working too hard, or maybe I had Taco Bell for dinner, that's why I'm bloated, or something. But those are external factors, right? Then we have family, friends, coworkers, social determinants of health. All of these affect the patient's illness behaviors. Chronic illness. Examples, these are some examples of chronic illness, and if you notice over here, there are 900,000 people die yearly from chronic disease. Almost half of these deaths are preventable, which is a huge statistic and very concerning. Then we have the different stages of illness. We have Stage 1, where you're experiencing the symptoms. Examples, you start feeling pain, or you're coughing, or you're bleeding. Stage 2, then you go to the next stage, which is assuming the sick role, right? Where you focus on symptoms and bodily functions. You may seek help, and you say, I'm sick. So now you're assuming the sick role. Then Stage 3 is when you assume the dependent role, right? You accept the diagnosis, you're following the treatment plan, you lose some of your independence, and so you need some help, with your daily activities, or you need emotional support. So this is when you lose a little bit of your independence and you start to depend on somebody else to help you get better. Then we have achieving recovery and rehabilitation, which is Stage 4, right? This begins in the hospital and concludes at home or a rehabilitation center. This is where you give up the dependent role and you start to reassume your normal activities and responsibilities. Every illness has an impact on the patient and the family. And this is very important for us as nurses to recognize this, right? For example, take an example of, say, a single mom. She's drops off her kids and is heading to work. She has to work, right, to pay bills. And on the way to work, she gets into an accident and she's in the hospital. Life goes on, right? Who's going to pick up the kids? Who's going to drop them off to school the next day? How long is she going to be in the hospital? How long is she not going to be working, right? Bills need to get paid. These are the realities of the world we live in, right? And it's very important for us nurses to understand this when we're treating our patients, when we're caring for our patients, and so the impacts of, illness on a patient and family, they include behavior, emotional changes, body image changes, self-concept, family roles, family dynamics, right? All of these impact, the illness. All of these are impacted by illness, sorry. So using the nursing process, I know we did not cover the nursing process yet. We're going to cover it next week, but the nursing process is a scientific, systematic way of providing care to a patient. Please read over this, and we will cover that next week as well. And now that we know what health is, what illness is, what disease is, how it impacts people, what are the risk factors, and what are the beliefs of health and illness, and how this impacts our patients. Now it's important to talk about the role of the nurse. What is your role as a future nurse, right? What is the nurse's role? The primary objectives of the nurse as the caregiver are to promote health, prevent illness, restore health, and facilitate coping and illness with illness, disability, or death. These are extremely important for us as nurses, and we talked about this last week as well. And we're going to continue to talk about this over the next few weeks as we talk about every body system. You're going to understand how a nurse promotes health, how we prevent illness, how we help restore health again and bring our patient to their maximum functional abilities. How do we help them facilitate and help them cope with what they're going through, or their disability or death? These are important things to remember as a nurse. So go ahead and test your knowledge. The answers have been provided. So, you can check to see if you got the questions right. And I will see you in class.